Hello everyone, with you Dr. Demchenko, and today I will tell you how to make my favorite anti-inflammatory compress. I often prescribe it to my patients, and each time I have to write it down on a piece of paper and explain the details of preparation. So today I will show you how to make it. Let's go! Be sure to read about the contraindications in the disclaimer. Now, about the compressor itself. It has a very good counteracting effect on dry rot, joints, muscles, and virtually any soft tissues of a depth of no more than 60 mils. That is, all tendinitis, inflammation, ligament strains can also be applied in case of gout and osteoarthritis. So we will need for its preparation for the preparation of the compress, we will need dexamethasone 4 mg, Novocaine 0.5% preferably in vials, to make it easier to handle them with ampules Voltaren, preferably 5%. Necessarily gel, not ointment, not cream. Mild saltpeter, syringe preferably 10 ml. And Dimexide, it is a pure solution, concentrated. Sometimes it is sold already 10%. So, the first ingredient will be pure Dimexide. Try to avoid getting the pure preparation on the skin and mucous membranes. It's good and convenient to measure it with the help of a 10 mg syringe. We draw up 5 milliliters. Since we are going to prepare a 30% solution of Dimexide, for its dilution we will take 0.5% Novocaine in a volume of 10 milliliters. Preferably take buffers, they are much more convenient to use. Before using the compress, be sure to perform a skin allergy test. For this, take a little of the prepared 30% solution and apply it either to the area of the wrist or to the area of the elbow band. And wait half an hour. If you do not have a pronounced allergic reaction on your skin, you can continue preparing and using the compress. Novocaine in this mixture not only acts as an anesthetic, but also as a means to improve local blood flow, thereby enhancing the action of other drugs. The next drug will be dexamethasone. This is a hormonal anti-inflammatory drug that is usually used for intramuscular injection or in a dropper intravenously. It has a pronounced anti-inflammatory effect. The thing is, when we apply it in a compress, a very small amount of it penetrates and in the exact necessary place. Therefore, we can exclude all the side systemic effects of hormonal preparations. We take 1 ampule of dexamethasone. And put it in the same solution. The next ingredient will be Voltaren Gel, an anti-inflammatory non-steroidal agent. Preferably take 5% and specifically gel, not an ointment or cream, because ointment and cream are fat soluble.
Bases, while gel is a water-soluble base.
This is required for it to homogenize well with the received preparation. Dispense approximately 2 centimeters of gel onto a spoon and mix it with the already obtained solution. Fold the solution, but the gel might not fully dissolve, but that's not a problem. Now take gauze pads, at least 4 layers thick. It's preferable to use gauze because they are paper agents and they absorb the solution too much and do not release it into the fabric. Take pads no less than 4 layers thick. Soak the pads well in the solution you've prepared. Place the compress you've made on the sore spot and on top. Wrap it with food wrap. hold the compress for up to 40 minutes. The compress can be applied from 1 to 5 times. If you don't notice improvement after 2 compresses, there's no benefit in doing more. Also, there's no point in continuing the compresses if all your symptoms have completely disappeared. If you need an urgent consultation with a sports doctor, manual therapies, or a physical therapy doctor, come to our Dynamica clinic. We will definitely figure out your problem. Until we meet again. Subtitles created by Dima Torzok.